Welcome, welcome, welcome in, everyone. Welcome to Care Concierge by Care Patrol, where education is the heart of everything we do. It's a beautiful, if not cold day, and we appreciate you sharing it with us for this hour. As many of you know who've been with us before, we're accredited by the Alabama Board of Social Work Examiners, and we're also accredited by the Alabama Board of Nursing. And each one of them tell us that this hour is worthy of 1.0 contact hour as a continuing education unit, and it is a supervisory contact hour for social workers. We have an evaluation process so that for you to receive credit for this hour, you must take our online evaluation. And that evaluation is password protected. We share the password at the end of the day. And in that way, the Alabama Board of Social Work considers this to be a live classroom hour and not a recorded hour. That's why we do our evaluation process the way we do. And as you know, this hour is free to all of you who are social workers and nurses and anyone at all, just as it will be if you take it later or you're watching it online on our YouTube channel, which is going to YouTube, searching Sean Barnes Care Patrol, and pulling up about 100 different contact hours that you can sit for at no charge. And these are also mirroring what Care Patrol does. We work for no charge to our clients, your patients, your referrals. We're paid by the providers in our network, and we help people find provider options, whether those be Medicare options, for which clearly we would not receive any sort of fee, or assisted living or sitter options, for which we do. And we'd love to be of help to you if it's just answering questions such as what does Medicare pay for, or how do you qualify for Medicaid, or what does home health cover. We're happy to answer your questions to save your time, and we're happy to work at any time for any of your clients, and we appreciate your referrals. Today we have a returning presenter with us, which is Dr. Kwajalein Nicole Brown, who holds a doctor of social work and is a personal counselor as well, and has actually served some clients of mine. She's a wonderful speaker. She has a very down-to-earth style, and she thrives on discussion. So hopefully you all will join in the discussion. Before we begin, let me just say, for those of you who may be watching this online or who may be dialing in by phone, let me read to you before we begin the evaluation link for the day, which I've also posted in the chat room. The link today for your evaluation in order to receive credit is https://surveymonkey.com/lowercase r/all uppercase letters, T as in Tom, M as in Mary, B as in boy, 8, W, G as in girl, Q. That's our evaluation link. I've posted it again in the chat room. And just to reiterate, these CEUs are considered live, and they are live. And because they're live, we really want your participation. Your discussion is so valuable. It's important for other people to hear your observations and your outcomes, and maybe also ask any questions you may have of Dr. Brown as she's presenting. So do feel comfortable in sharing your opinion with us Dr. Brown, I've rambled enough. I'll open the floor to you, and thank you so much for being here.
Oh, you're welcome. Um, Let me go ahead. I wanted to start out by telling you why I was asked to do this particular presentation. I have been a social worker for over 20 years. I've been a clinician for over 15 years, and I am a certified clinical supervisor. So I've taken the classes that the state of Alabama has required of us all to take in order to be able to provide social work education to my colleagues and my cohort. But if you have any other questions, by all means, ask. I most definitely will welcome any of the questions that you have. All right, so the role of clinical supervision, I know it sounds a little redundant for some, but maybe not. Social work supervision is a cornerstone for professional development because it ensures that our social workers provide competent, ethical, and high quality services while growing in their roles. And effective supervision fosters professional identity, critical thinking, ethical decision making, and continuous skill enhancement. So this is for the betterment of the profession as a whole. But it also is for ensuring that we have ethical practices across the board, and ethical practices are non-negotiable. It's something that we talk about all the time within our work and with our students, with colleagues about being ethical in our practices. So supervision, most definitely, I talk about ethics all the time when I talk with my supervisees. And I talk about, providing guidance on what ethical dilemmas that they bring to supervision. And we talk about adherence to NASW Code of Ethics and risk management. And then, of course, because we're social workers, I also talk about cultural competency. Um, we want to enhance client outcomes, right? So the ultimate goal of social work is positive client outcomes, and supervision directly contributes to enhancing those clinical skills and those professional skills. So case consultation and problem solving, skill development, improve self-awareness, emotional intelligence, and consistency in how you deliver your services. It provides professional growth and consistency in building your practice. Um, and also, you think about mentorship and career development and critical thinking skills as well. Ooh, sorry, y'all. I wasn't supposed to do that. Here we are again. All right. So here's some objectives that we're going to roll through for our time here. I want to make sure that you understand the role of clinical supervision. But I wanted to ask a question. It says a quick poll, but how many of you are actually currently under supervision or have looked for supervision, know someone looking for supervision, only asking just to get a a survey of the land, like who's here? And the reason being is because I remember when I was looking for supervision, I didn't know what I was looking for. I just knew I needed someone to supervise me so that I could get my clinical license. I'm just honest about that.
Miss McCoy just finished supervision. Miss Crowell is being supervised. Miss Garcia is under supervision, and Miss Hurd is providing supervision. Miss Vincent is considering it.
Okay. Now there are a lot of people. There's a balancing scale of that. Some people are on opposite poles of whether or not being clinical really benefits them in their work or what their goals are for the future. But those of us like me, I like to have options. So my option was to get the clinical supervision because like I said, I wanted the option, but I knew that I wanted to be a clinician. But there are other options that you can use with, the clinical supervision once you get ready to sit for your exam. And I really honestly feel like having clinical supervision helps with preparing you for taking the exam. I know that I tell anybody that is under my supervision that if you don't learn anything or that you don't pass that exam, I didn't do my job. And I stand on that very firmly, because not only do we talk about administration, we talk about being a clinician, but we talk about other facets of being a social worker, so that they are prepared to sit for that exam, because I know that sitting for the exam costs too much money. Okay. And it costs a lot of time to study. So as I am your supervisor, I'm your study buddy as well. But that's only me. I don't know how other people do it.
Miss Smith has completed supervision. Miss Osby said she began it twice, but did not finish, and she's planning to begin again in 2025. Maybe that's seeking the certification. Miss Miller's a provider of supervision, and Miss Albright can provide, but she hasn't taken on any. And Miss Loy says she does the same thing as you with her supervision girls.
Mm-hmm. I learned that, I want to say, the hard way and the easy way, because my clinical supervisor didn't tell me. I knew there was a test coming. Okay, y'all. I didn't know there was a test coming, but I didn't know what was on it. She couldn't tell me what was on it. She she was great. She was great. I worked for the state of Alabama when I was doing my supervision. So that gives you any insight into what that looked like. I was there because I wanted it, but also my agency needed me to be there. Clinical supervision is formal and it's structured. It's supposed to be supportive in enhancing professional development, ensuring ethical practices, improving client outcomes, of course. It's supposed to provide guidance on case conceptualization and skill development and ethical decisions. Sometimes people are receiving that and sometimes not. But it also is supposed to be offering you emotional support and burnout prevention. And I personally feel that those were the areas where I probably needed a little more help, but I was not receiving. So I make sure that we all are making sure that we're doing that now. We're doing that through reflective practices and mentorship. It's supposed to foster competence and confidence for our supervisees. Okay. So won't give you a whole lot on this history of the evolution of it, but just know that we went from early foundations of settlement houses and poor men's wages and to evidence-based information and structured supervision. So we've come a long way in the practice of social work, and in the profession of social work, we have a ways to go, but we definitely went from very informal to formal practices in social work. I wonder, does anybody actually agree with that we went from formal to informal? Let's talk about the importance of clinical supervision. Some people would say that getting someone else to provide information to you and tell you what you need is not very important. But there are regulatory requirements, but a vital competence of professional growth and client care here. The professional growth and development of clinical supervisees, we wanted to provide protection for welfare of the client so that they're not harmed while we're training our supervisees. Here's the thing about that. When somebody is under my supervision, they're working under my license. So when you are finding a clinical supervisor, make sure that you understand that you're working under their license. For the lack of, you don't have a license, they do. And the reason why you are able to provide some of the clinical services that you do is because you're working under someone else's license. So it's very important that, there be some type of relationship there and that you understand what that looks like. So we're providing a watchful eye to ensure that you are practicing within guidelines. And that means that we are in some ways the gatekeepers for the profession. So we're supposed to be teaching and training and empowering you to become more competent and independent clinicians and administrators. So there is a formal and a informal types of supervision. There are planned formal supervision. The advantages are regular supervision with with your person. There's time for you to prepare. It's structured. The unplanned is you just kind of come in. You don't really have an agenda there. You're just kind of doing, right? And so this chart just kind of shows you where you may fall into some people's views of what supervision looks like. My supervision style, with depending on the person that I'm with, it's very much planned and formal, but informal at the same time. So we are trying to build a rapport, not only with you, but you're trying to build a rapport with your clients. So in some ways, I am building rapport with your clients through you. But my interaction with you is not going to be so formal that you can't get to know me, because if you can't get to know me, you won't trust me. And in the same likewise that we talk about our clients, if they don't trust you, they don't talk to you. If they don't talk to you, you don't have the information. If you don't give me the information that you need to become a more competent clinical social worker, then I'm a disservice to you. So what we're looking for there is to make sure that we're all in the circle of life there, making sure that although we're formal with the information, we're informal with maybe the ways that we talk to each other sometimes, so that there's, a free flow of information there. So I put this here because the supervision model looks like, okay, you have individual supervision one-on-one. You have group supervision where I think DHR still does it this way, where there's a group of you and you go all in at the same time. Then there's live supervision. Now, I know that sounds weird because you're like, what is live supervision? Is that supervision on Zoom or something? No. Live supervision is where you are together with your supervisor at the exact same time, and I am providing in-time supervision and correction gently as you provide that service. So I'm literally either sitting next to you or I'm in your earpiece, and I am watching from maybe a two-way mirror, something like that, and I am providing correction. But this is also done under the guise of this client knows that I'm there, right? So they have provided their consent that I can come and provide that direction, and they're okay with it. They're not okay with it, we would not do live supervision. There are other places that you should not do live supervision, one of which would be, say, at one point I had a supervisee that worked in, I'll use Bryce, so somewhere like Bryce. That would not be a good place to do a live supervision, right? And there are other places, but that's a good example of somewhere where we wouldn't. A place that would be a good idea to do something like that would be maybe like a DHR, where you're doing like maybe your ISPs, or you're doing casework with the family. So the family would know I will be a part of their ISP or a part of their signature process of them release of information, knowing that I was there and that I would be a part of this particular interview. And I will provide live supervision during that time. Informal supports would look like peer supervision. That's where we all get together at lunch and we're talking about it. And we're not necessarily in our feelings, but I provide some feedback, you provide some feedback. And it can help with developing skills and moving cases forward, but it is not considered clinical supervision. It can help with well-being and sharing and supporting. It can help with your overall morale, but again, it is not going to be considered supervision. And then there's, the informal, where basically we are shopping, we are talking to our friends who happens to be a social worker or who happens to be a supervisor, but I'm venting to her, she's listening, she's providing some information that is not clinical supervision. And I'm sure that everybody here knows that. But those are some models that have been, brought up as to how people get their information and prepare for the exam, or what some people actually consider to be clinical supervision.
Ms. Miller had stated a little earlier, yes, well balanced and personal with the professional.
Yep, you got to, because this person is your colleague, really, in some ways. I mean, they're your colleague, and you're basically providing a service and helping them to further along their professional role. So yeah, it's very much so helpful. There is an overlap between administrative supervision and clinical supervision, because when you're thinking about the administrative sides of supervision, and the functions of it, administrative supervision is focused on the organization as a whole, like the big picture, the organization and the effectiveness, ensuring that social workers comply with agency policies and procedures, the regulations, the laws. We're gonna, they're looking at the workload management and policy and compliance, performance monitoring. So when you're guiding someone with to be an administrator, you're guiding them to lead an organization. Now, when you're doing this on the clinical field, you're really thinking about guiding them with case conceptualization and decision making, client outcomes, professional growth. Now, they both interface, because when I provide supervision, I do this all at the same time. So we may be looking at a case, but I'm also, I may have someone that says, well, I don't understand this. And why does it look like this? And why is it like this? And, I'm like, well, listen, you got to think about this from a business perspective. So we're looking at macro, we're looking at micro. Let's look at this from a business perspective. How would this look to you if you were in this seat? So I provide a look at this in a couple of different ways, but most definitely trying to make sure that we see the cool side of the pillow too. And while there are two types of supervision, and they have distinct purposes, like I said, they overlap. But what does overlap is the ethical practices, the quality of the service delivery, the professional development, accountability is what overlaps. Although they may, you may be looking at this from high and low, what overlaps in the middle are those things. Let me make sure is any question about that? I want to make sure that I covered that. I know I covered it, but that there weren't any questions about the differences between the administrative side and the clinical side of what supervision looks like. Because one is looking at the puzzle, and one is looking at the puzzle pieces.
Oh, that's a unique way of putting it. Ms. Miller says it makes sense logically. What does it look like in practice?
Okay. In practice, it looks like I wanted to diagnose this person with this particular DSM diagnosis, and they need this particular medication. And my agency says no. My agency says no. They're not going to do it. They're not going to provide the supports. They're not going to provide this. And I don't understand why. And I think that's stupid. And while I do agree with you that may be stupid, but you have to look at why they're saying no. Are they saying no because we're not going to pay $100,000 for one patient? Because if we're paying $100,000 for one patient for Seroquel, making this up, y'all, for Seroquel, then, and they're not going to pay for the bed to send them to Passages in Malibu, California for that one particular patient, and you think it's stupid because they need it, because this is what's going to revolutionize this particular patient and break them free of their, DSM diagnosis, or at least make them or help them to become more productive in their community. What I have to look at you and go is say, sweet love, they're not going to pay $100,000 for your patient to go to Passages in Malibu because you feel like that's a good thing. Because if we take $100,000 from this for this particular patient, what about the patients the other people on your caseload? You could take that $100,000 and you split that up amongst 10 of your clients and send them all somewhere comparable, but in state. And I would explain to them on the administrative side why that doesn't look good for you to spend $100,000 on one particular client. Does that make sense? I hope it does. And I just dumbed that down, or just kind of watered that down a little bit. So it would look like that in practice, or with me having that conversation, because sometimes that's what it boils down to. I want to do this particular thing, or I think this particular client needs this particular thing. And my supervisor or my agency says no because of this, or this, or they gave me some runaround about that thing. And what I help in some ways do is explain from the like I said, the cool side of the pillow, why the possibility of why that would not work. And if you still believe in that, let's brainstorm in how you can potentially get what you need for your client, but at a cheaper cost if possible.
Ms. Millerson, thank you. Yes, that made sense.
Okay. All right. Frequency and duration of supervision. This is not negotiable. In the state of Alabama, you have to have 4 hours worth of supervision per month. That can look however you want to slice it, dice it, lay it to the side, however you want to do it. But it has to be 4 hours of supervision per month for 24 months. Now, they give you a little leeway on the 24 months. They say it has to be consecutive, right? So there's some people that are going on maternity leave or something, and they may need to take a little time off. I'm gonna back that up, because everything I said was still true, but maybe I didn't make sense. So let me make it as clear as mud. You need 4 hours per month. If you have 3.5 hours, that month does not count. You have to have 4 hours, whether that's for 1 hour a week, 4 hours in one day, whether that's 30 minutes, I don't know, 30 minutes twice a week, however you want to do that, has to be 4 hours. If you don't get the 4 hours worth of supervision during that month, it does not count. You need 24 months of consecutive supervision to make that work, meaning if you, for instance, you get the flu or you got COVID or something, and I know COVID doesn't take but a week, but just go with me here, and you're out for a month, cool. We can go without that month, but you need to continue to proceed to the next month and continue that on. You need to be able to provide documentation or explanation as to why it didn't happen for that month that you skipped, but that we're going to proceed and we're going to keep going. So in the 24-month span, we have 4 hours consecutively for all of those months. But you get, like, I think it was 36 months you have 36 months to complete. So within that 36 months, 24 of those months have to be 4 hours of consecutive supervision. I think I'm clear, crystal clear now. 36
Wait a minute.
months.
You mean the hours in succession, you have to have 24 months where they have 4 hours each month in succession within the 36.
Within the
This boy
36.
says that's right. 24 out of 36.
Yeah, 24 out of 36. And so, like I said, if you happen to get sick or you have a baby, you have a little leeway there. If you run out of the 36 months, then you must keep going, or you have to I would say call, but also send an email to the state board and ask them how they would like you to proceed. Because sometimes it used to be they would make you start over. They may have a situation where maybe a month or two fall off and you have to complete 2 extra months. But know that you have to have 24 consecutive months within 36 months. If you go over that, you need to talk with the state board so that you can have some approval. And that approval probably has to go with your, you have to staple that to your application for exam. All right. So qualities of a effective supervisor. So here, I want to say self-explanatory, but not really. You want someone that has some clinical expertise, someone who's actually been a clinician and who actually has some um, information and some meat behind the things that you want to do or the places that you want to go. And you want to talk to them, of course, and see if they exhibit any strong ethical standards and integrity and their communication skills. And see if they give you any constructive feedback. So, someone with some clinical expertise, some ethical integrity, and effective communication, and someone who is supportive yet challenging. You won't know that unless you talk to them. So, most definitely have a good conversation with the person that you are thinking about being your supervisor. Word of mouth works, but you definitely want to have a conversation with that person because you really want to be on the same wavelength with this person because you're potentially going to be with them for 36 months. So kind of want to be with someone that you have a good feeling about.
Miss Bowers asked, does the state allow more than 4 hours? I read somewhere that the maximum is 6. Just wanted to verify.
I've been told 4. 4 is within the on the website and within the documentation that we have from the State Board of Social Work. So if you have more hours, I would say call the state board and ask them about that and make sure that that's okay because, you don't want to do 6 hours and then don't get credit for those 6 hours. I would call but I would also send an email. Or we can send an email and then call or do both, but make sure you have that documented if they're okay with you doing 6 hours in a month. That's what I would say.
She says, okay, thank you.
Because there may be some people that are doing things below board or under the table, and they're probably doing the 4 months, they're doing the 6, and something else is happening. I don't know, but I've always been told 4 at the maximum. So the relationship between yourself and your supervisor, you're wanting to build trust. Like I said, you're going to be together for 36 months. And you want to maintain the professional boundaries. But again, this is your colleague. This is someone that you'll be working closely with someone that you'll also be working with outside of the supervising role at some point, possibly. So professionalism, yes. Mutual respect, most definitely. Like I said, a balance of professional and personal would be what you're looking for there. All right. So starting out by identifying your preferred learning style. What's your learning style? How do you learn? Are you like reading it, listening to it, hands-on? Like what type of reader are you? What type of learner are you? And how do you best receive the information and even how you best give the information out too. But then you want to clarify your short-term and long-term goals. Like, what do you want to do with supervision or what do you want to do during supervision? What do you want to do with this after supervision? right? Like what's the point in doing this? What's the point of it all? And then you reflect on previous supervision experience, meaning in other jobs. What worked, what didn't work, and how did you best receive criticism? Because here's the thing, when you're in supervision, criticism is going to happen. You're going to come in and go, oh my gosh, this happened, and you will receive at some point gentle guidance or gentle criticism. How are you going to, how do you best take that? And think about this, really the self-assessment is to think about yourself, like really be honest with yourself about what your goals are, long-term and short-term, and how do you best learn? And then, you know, in your previous jobs, how's that worked out for you? What supervisors stand out to you? And then that's kind of where you might want to guide yourself as to how what you're looking for in a clinical supervisor. Because like I said, this person is going to be with you for 36 months. A lot of the people that I've supervised, or all the people that I've supervised, I don't know why I said a lot, I still know them to this day. And I talk with them often. I check in on my supervisees all the time, even though we are no longer in that role. I just pop in a couple of odds. Hey, how you doing? Do you need anything? Do you need, you know, how's it going with studying? Do you need me to go over something? You want me to send you a any information that can be helpful? So in this is self-reflective. With the self-assessment, of course, this is self-reflective because this person is going to be a big chunk of your professional career for a while. All right. So everybody knows about SMART goals. I'm not going to insult your intelligence by telling you anything that you already know. But when you're setting your supervision goals, the state wants you to be very specific about your goals, be very concrete. They want you to color in the lines. So you're going to use SMART goals to do that, right? They're going to be measurable. They're going to be achievable. They're going to be relevant, all that good stuff. That's what it's going to look like. And your supervisor is going to help you get there. Yep. And then they're going to be connected, at least my supervisees, they're going to be connected to your long-term and short-term goals. So at the time that you're looking for a supervisor, you're interviewing me, I'm interviewing you. What are your goals? What do you want to do? How you want to get there? So that, you know, we both know if this is going to be a mutual fit. So how are you going to find these people? Professional networks, academic connections, online directories, conferences, word of mouth. There's quite a bit of ways to do this. I wish there was like a dating, like, you know, there's a dating app and you swipe left and you swipe right. Maybe you could do that for professional stuff too. You just start swiping left and swiping right. But you know, these are the places that you can find a supervisor. I myself am a supervisor. And like I told you, when I was looking for a supervisor, DHR told me who my supervisor was. They told me, go to this place at this time, and this is your supervisor. I didn't ask for this particular person, but nevertheless, she was my squishy. And I ended up, when she retired, ended up with another supervisor, whomever the agency provides. And that's another thing. Supervision, when you have choices with supervision. If you work in an organization that has an LICSW there that is then and that has taken the course, then you have a ready built supervisor, right? But don't be surprised if they're not going to ask you what your professional goals are and all that stuff that I was just talking about back there previously. They're not probably maybe not going to ask you that, because if you are using a supervisor that is attached to your organization, you are going to be organization driven in most cases. If you're working for, I don't know, Lifesavers or else. Basically, your supervisor is going to be, they're going to be doing the exact same thing that you are. The goals are going to be driven toward the missions and the statements and the policies and procedures that are that of the organization that you work for. If you are looking for something a little bit more than that, you may have to go outside of your agency to find that. There are some caveats about that I'll talk to you about in a minute, but there are some choices, like I said, choices within your agency or outside of your agency where you can find supervision. But do not be surprised if you use an agency supervisor. If you have specific goals, if you want to start your own agency, if you want to start your own nonprofit, if you don't get a chance to talk about those things in your supervision time with that person, don't be surprised, because that's in some ways what happens there, because the agency is paying them to supervise you so that you can stay at the agency that you all are both at, not so that you can gain more information and then leave. And then leave. They're not going to do that. If anybody has a thought about that, please let us know in the chat. Okay. So when you're interviewing these people, what kind of questions are you asking? I want to know. Put that in chat too. What type of questions are you asking to find your right fit, right? Like, are you just asking, I don't know, hey, like who else have you supervised? Like, what type of questions did you ask to find your right fit? Those people that have already finished, or if you finished and you were like, dang, I should have asked that question and I really did not. What questions should you have asked? So people that are in this situation or coming up on this situation, trying to find a better supervisor, what type of questions did you ask to find your right fit?
Leslie Miller asked, what is your supervision style?
Okay. All right. Yeah. I think that's actually what I have there. One of the other ones that I put was approach the ethical dilemmas when you're supervising. When somebody asked me once, like, how would I, something along the lines of, would you stand up for your supervisee if there was, I'm being loose, if there was ever a discrepancy between what you suggested that I do and my actual supervisor. And I said, I'm about that life and I stand 10 toes on whatever I say. So if I make a professional suggestion, I'll stand by it. I'll make a phone call, I'll make an email, I'll stand by it, because ultimately you're practicing under my license. And after you and I confer and we have worked that thing out, if your supervisor says, no, I still want you, even though you didn't write this plan, this treatment plan, and somebody wrote this treatment plan 3 years ago, there was no signature, and I want you to sign this treatment plan. And you say, Dr. B said, we're not doing that. And your supervisor says, well, you tell Dr. B, and you be like, oh, that's all right. Pick your phone up. Give me a call. I answer the phone, because we don't do that. That's unethical. It's not, we're not doing that. Good example.
Ms. Miller also asked, understanding what their political stance is.
Ooh, that's on a tip and a tightrope. Now, you can ask that, and if your supervisor wants to answer, yeah, I feel like that's, I wonder, my thought would be, what would be I know the answer, but I'm gonna say it anyway. What would be the reasoning for asking their political affiliation, as as it connects to supervision? And like I said, I said that I double talked myself. I understand that I understand what the answer may be, but I still wanted to ask so I don't make an assumption about where you might have been going with that.
Ms. Hurd says she has been asked how much hand holding she does during supervision.
Ooh, that's a good one. That's a good one.
Miss sorry, Kimberly Ford says, how do you assist with LICSW test prep?
Okay. Yeah, good one.
And Ms. Miller, I think, answers your question by saying ethics and values as a social worker matter.
And sometimes you can feel that out based on, my grandma used to say, sometimes you can tell a lot about a person by the way they dance. So I understand what you're saying about, you can tell a lot about a person by the way they vote. I would just, like I said, you can walk a tightrope with that one sometimes, because people are real iffy about telling you who they voted for. I don't know. But I understand what you're saying, because I mean, your ethics and your values are directly connected to the person that you will be supervising, or both ways, right? So you want to make sure that person aligns with like your ethical values, and that's what the interview is for, right? I'm interviewing you to see if I want to supervise you. You're interviewing me to see if I'm the type of person that you want to be on your I want to say your LICSW Rockstar team. So yeah, I get it. I definitely get it. And I agree.
Miss Miller also says she's on fire. Do you mix your religion with your supervision?
Mm-mm. Mm-mm. No, 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 I don't.
I don't know that she's asking you. I think that's a question for potential
Oh
supervisor.
yeah. I was answering. I was like, like I said, that's a tightrope thing, but I get where you're going with it. Like, what's her last name? Miss Miller. Yeah, Miss Miller, you're on fire. Like, I get it. Because like I said, you still want to be within that, you want to be within evenly yoked type people, like-minded people get together and they have a good time, or they understand each other. So no, I absolutely get you. I try to steer I try to steer in the middle, as far in the middle as I can with those things. Religion can be really sore for some. But no, I get where you're going with it, and I agree. You just have to walk lightly and carry a big stick. Yeah. All right. So you want to know that person's credentials. How much supervision costs? Where are we doing in supervision? Is this person flexible? You want to know these things. Because if the person they do have an LICSW, but they do not have the credentials to be a certified supervisor, they can't supervise you anyway, even if they work at your agency. And this, I think we already went over this. Yep. Assessing their alignment with your personal professional goals. Thanks, Ms. Miller. We went over some of those things. Yeah. And so that would go into what are the red flags? Their lack of accessibility. Can you call them? Do they answer the phone? Unclear or blurred boundaries. Like, can your, I'm glad Ms. Miller said this, can your youth pastor be your supervisor? Can your, I don't know, sister-in-law be your supervisor, right? Some of the red flags may be that you find out through the grapevine that your supervisor is telling your professional, personal business. Red flag, whole bunch of red flags. That person being inflexible, they're being rude, they're being dismissive, they're not answering your questions. Red flags. Even on your interview with that person, are they answering your questions, or are they tiptoeing and dancing around it? These are the ways that you identify whether this person is going to be a good fit for you. And these are going to be problematic. So if they're problematic in the interview, they're definitely going to be problematic in the relationship. Red flags. Then there has to be a contract that we don't make the rules, we just enforce them, right? So the state says that we have to have a contract, and we both sign it with your goals, your objectives, how often we're going to do this. There's a confidentiality clause, how we're going to evaluate your practice. All of this now goes into your proverbial binder. And used to be, before 5 years ago, you could work this out however you wanted to. Now you have to have a paper trail, whether that's electronic or pen to paper. You have to have a paper trail of what you're doing, what you're learning, and the things that you're talking about. And then the contract spells all of those things out for you, and it can be amended as needed. So I'm just running right along. There is, we're going to keep notes. We're going to keep all the information that we talk about. You have to bring things to supervision for me to be able to help you with. So you may have to bring your case file. If you need to redact it, fine. However, understand that there's a confidentiality between you and I. And if you're working under my license, I need to know who we're talking about. Because if we all have to go to court, not only do you go to court, I go to court because it's under my license. So we all going to court looking cute, and maybe Olivia Benson will be somewhere around, maybe not. And
Miss
so,
Loy has a comment.
uh-huh.
She says, let me find it. I love you saying to call and email for documentation. I've learned you can also email your supervision forms, even though it says to mail it in on the form. I've learned, I'm sorry, I've learned the hard way that you can't rely on the mail because they don't get the forms a lot of the
Yeah.
time, and then it's on you. They assume you just never sent it in,
I
and then
do.
you have to appear before the board to state your case. Some people, not ones I supervised, have had to repeat supervision entirely. Just wanted to share it so it never happens to y'all. Make sure you always get something back from the board verifying the form you sent. Otherwise, you can assume they did not get it.
Ooh, yep. That was actually coming under documentation and supervision. But thank you for saying it. So I didn't, because I agree with everything that you just said. I have a Google Doc that I share with my supervisees. We put everything in there, right? We put everything in there, but I still keep a paper copy. Still keep a paper copy, and we send those things to the board. We send them in color, so you can see if we use blue ink, so you can see what we signed and things like that. I agree with everything you said. If you can call them, email them, take pictures of things, and you can even do certified mail. So they will, if they have to go to the mail and sign for it, they're more likely to send you something back. More likely. Doesn't mean that but yeah, they're more likely to. And when you're doing your documentation for supervision, you want to make sure that you have the right, the dates and times and things like that. Remember what I said, that you have to bring things to supervision for me. So if you have a case that you want to tell me about, bring me the file. Bring me the file. Bring me excerpts of the file. Bring me something, because like I said, we have to be able to show the board what we went over. And we can't say that we fictitiously talked about a fictitious person, because what they want to know is if you actually talked about real live people. And what they also want to know is if you say you have a job and you work at such and such place and you're using me as your supervisor, are you using me to actually provide information to you that you're needing, right? So they want to know what cases we talked about. And we can't say that we talked about cases if you didn't bring me a real live case. So the purposes of that is to show and to track your development and your learning, the learning process, identify your improvement areas. So you have to bring things to supervision for us to be able to document to the board that we're doing what we said we were going to be doing in that contract. Yeah. All right. There may be some challenges in your supervision time. There may be case complexities. There may be professional butting of heads. Like I said, sometimes there may be something that's going on. There may be a disagreement between what maybe I suggested and what your supervisor actually wants you to do, that may sometimes be unethical, because sometimes we're supervised by individuals that are not social workers. So we definitely have to be cognizant of that. And when that happens, we always default to our ethics, our code of ethics, which is social work code of ethics. You may be supervised by in your job by an LPC, but an LPC is not a social worker. We always default to social work ethics, always. At one point, I was supervised by someone who had a bachelor's in divinity. Nothing against it, good person. But I had to default to my social work code of ethics, because that wasn't going to protect me if anything ever happened. So just wanted to say that. And there may be some other challenges that come up, like lack of supervision time or policy and procedure in your agency. But we try to use our code of ethics and your agency's policies and procedures, and try to marry those together as best as possible. All right. Ethical considerations. There we go. Code of ethics. Dual relationships. Like I said one time, can your pastor be your supervisor? Who knows if you want that to happen or not? But it's a dual relationship, and you have to think about those things. All right. The benefits of strong supervision. You got professional growth, increased competency, and enhanced client care, and all the other good stuff like increased job satisfaction, reduced burnout, high retention rates, greater career advancement, strong ethical decision making, and work-life balance. Here are some resources. These are specifically NASW resources that talk specifically about you are looking at the website, but then you're also looking at the law that is connected to social work and social work supervision on the website. So those are that's what you're looking at there. And I can share that if you like.
Yeah, will you share your presentation and I'll send it as a PDF out with the certificate?
Sure will.
Okay, and I'll restate our evaluation link. Thank you for putting it in your slides. It's https://www.surveymonkey.com/all uppercase letters T as in Tom, M as in Mary, B as in boy, 8, W, G as in girl, Q. And our password today is capital S Supervisor. I've posted it in the evaluation link and the chat word in the chat room. Supervisor, so you know, is spelled capital SUPERVISOR, Supervisor. Ms. Vincent says, thank you so much for this information. Great presentation. Ms. Smith says, thank you. Great presentation. Ms. Hurd says, thanks very much. We thank you as well, Dr. Brown. Always a good time when you present. I appreciate your style and the information you present. Leslie Miller says, thank you so much for your time today. Thank you, says Tierra Paul. Thanks, says Alice Delois Alexander. I'll get us on out of the hour. I hope you all have a great day and week ahead. Join us on Monday, March 3rd, when Billy Curtis of the Alzheimer's Association will be presenting Dealing with Difficult Dementia Behaviors. And so for those of you who work with those who have cognitive impairment, this should be a great upcoming CEU for you. It was great today. Thank you, Dr. Brown, so much. I always appreciate you. As there are no more questions, I'll sign us out for the day.